Are you getting ready for CPC exam? Then you must focus on E&M coding guidelines. From E&M, you will get 6 to 8 questions, which includes chapter specific E&M questions and also case studies. So to assist you, let's explore some sample questions on E&M coding guidelines. Before that, don't forget to subscribe to our channel and hit notification bell so that you can be updated with our CPC exam videos. So let's start the video. First question. Time is not a descriptive component for which of the following E&M service? First option, nursing facility, emergency department, office, or critical care services. So the answer is emergency department. So let's see why time is not a descriptive component for emergency department. As you can see in emergency department course, there is no mention of time. So time is not a determining factor for selecting the code. Instead, the code selection is based on the patient's presenting problem, the amount of history and examination required, and also the medical decision making. So time is not a descriptive component for emergency department. Next question, if critical care services are performed in emergency department, we have to select the codes from emergency department. True or false? The answer is false. We have to select the code from the critical care services. Here it is given as for critical care services provided in the emergency department, see critical care guidelines and 99291 and 99292. So if the critical care services are provided in the emergency department unit, then also we have to code the critical care services only code. You should not code from the emergency department. Next question. Critical care services include pulse oximetry, gastric intubation, vascular access procedure, all of the above. Here, the answer is all of the above. So, in critical care services, pulse oximetry, gastric intubation, vascular access procedure, all are included in the critical care services. So, as they are bundled into critical care services code, we should not code as a separate code while it is performed as a critical care services, as a part of critical care services. Here you can see the following services are included in critical care when performed during the critical care period by the physician providing critical care. So these are the following services. Cardiac interpretation of cardiac output measurements, chest x-rays, pulse oximetry, blood gases and collection and interpretation of physiological data, gastric intubation, temporary transcutaneous pacing, ventilatory management, vascular access procedures. Any services performed that are not listed above should be coded separately. So if any services that are performed are not mentioned here, then we have to report them separately. These services should not be reported as they are included in the code. We will see one example question. The question, the physician provided services to a critically ill patient for 80 minutes. During this time, the physician initiated chest x-rays, pulse oximetry and ventilatory management. What code should be reported? So in the options here, 99291, 99292 are common in these options. So here the code 71045 is for chest x-rays. 9460, 94760 is for pulse oximetry. And 94220 is for ventilatory management. So these codes are included here in these critical care services. So we should not code them separately. So we can eliminate these first and second option. So coming to here, the patient was provided critical care services for 80 minutes. So in code 99291, the critical care evaluation management of the critically ill or critically injured patient first 30 to 74 minutes only. So here in the question 80 minutes is given. The code is covering only 74 minutes. The extra 6 minutes is for extra 6 minutes we have to code the add-on code 99292. So this will be the answer and this will be eliminated. So like that, if you know the guideline, you can easily eliminate the code and select the correct answer. Next question. No distinction is made between new and established patient in which department? Outpatient, inpatient, emergency, nursing facility, services. Here you can see in outpatient, inpatient and nursing facility, the codes are divided based on new patient or established patient. But in emergency department codes, only one set of codes are given. There is no distinction between a new patient or established patient. So the answer is emergency. Here in the emergency department, it is also given as no distinction is made between new and established patients in the emergency department. So, because whenever the patient comes to emergency department, the focus of the provider will be on providing immediate and necessary medical treatment for the patient, but not on the patient history with the facility or the provider. So as said, the patient status as a new or established patient is not relevant in the emergency department. Newborn care services are used to report the services provided to newborns. Newborn age is 0 to 24 months, 0 to 12 months, 0 to 6 months, 0 to 28 days. So when we go to newborn care services, it is mentioned as the following codes are used to report the services provided to newborns birth through the first 28 in different settings. So the answer is 0 to 28 days. So these are the 5 E&M coding guidelines question. So mastering E&M coding guidelines is crucial for passing the CPC exam. Best of luck in your examination preparation. Thank you.